Good morning, good afternoon. I hope you are all well. It is a pleasure to share my abilities first as an example of a global partnership. I have nothing to disclose. All my ideas and opinions are guided by the ICF and the conventions on the right of the child and people with disabilities. The project started with this qualitative study where we asked children with cerebral palsy to describe what functioning meant to them. And we learned the importance of doing research with children and not on children. And the title summarizes the finding. He does not see himself as being different. And we learned that children celebrate their abilities and facilitators. So for me, that was a starting point of my abilities first. This project breaks with the traditional view of disability in healthcare and trying to emphasize a rights-based approach and why it's important to include a positive language in healthcare. The idea is to include systematically abilities first from the perspective of the children or the individual with a disability. I published this paper describing the project last year, and it was included in a special issue dedicated to disruptive education, which is interesting to think about why talking about abilities is considered disruptive education in medical care. Briefly, my abilities first includes brief educational animations asking people to reflect on how you describe yourself and why we concentrate, why it's important to concentrate on abilities and how we can create my abilities first identification card, sort of a passport in healthcare, describing abilities and using positive language. You might remember that we share an example of a program using an abilities-oriented approach last year at the EACD conference, and it was describing the accessible care pregnancy clinic in Ontario, Canada. So how do you start these global partnerships? It's important to start building connections, and this was a growing process over the years while we were working on ICF-related projects, and I'm going to show you some of the examples. How it works, the idea is to share information and in this case, the goals of the project, and each one of the teams in their countries, they'll do cultural adaptations of the materials and the educational material. Is key to have leadership, clear leadership in each one of the teams and using innovative strategies depending on the setting that you are going to use the project. Feedback and modifications are always useful, and you need to be flexible about, the output and the outcomes of the project, and active dissemination, like sharing information in presentations like this one. You know that a global partnership is working when some of the team take the project and make it better. And this is the example of Taiwan. Taiwan has one of the best healthcare systems in the world, and they took the project and made it better. They created educational courses in different settings, like educating teachers, educating physiotherapists at the university level. They created a team, the first national My Abilities First team, and they invited different stakeholders from the Department of Education, from the government, from different professionals. And you can see one of the pictures, they did a workshop inviting parents and children and creating My Abilities identification cards. They also created a Facebook page dedicated to the project, and they are working nonstop disseminating their work at a national level. Brazil is another example. They took the project, but you know that Brazil has been going through a tough time due to COVID. So this is an example of how they're starting a quality improvement project inviting children with different disabilities to share their abilities and create My Abilities identification card using short videos or a picture or a drawing. So this is another example on how a different team in a different country, in a different level and situation can adapt the project. The idea is that each one of the teams report back and we share information about the progress of the project in each one of the countries. I finally want to mention My Abilities First in Poland. You might have seen some of the examples that about Abilities First coming from Poland, and I want to mention that they created a group, My Abilities First group, that facilitated kids with different abilities to share their opinions and created beautiful videos that you can access here. What are the secrets to a successful partnership? For me, it's having a common goal. And this picture illustrates the project. We're building something together, which makes us having fun and share joy. There are many things, many words that can describe what we're doing and how we keep the teams motivated, share interest, rights, hope, good motivation, and hoping for a positive change. I think this is a common goal. The shared interest is truly and meaningful social inclusion for kids with different abilities and regardless of the physical limitations. Lesson learned ongoing. It's key, as I mentioned at the beginning, to involve the children, young adults and their families to work on this project. We need support and local networks, and we need to keep educating the public and all the professionals involved serving and providing services for children with disabilities, advocacy for rights, and I think communities are ready for a change. In conclusion, the message is we should focus on disabilities and not disabilities. And in this conference, for the first time, we're sharing Abilities First using a positive language on the front page of the meeting. So I think a change is in the air. And I want to say thank you to everybody who participated and helped the children to participate in this global campaign. The EACD launched a couple of months ago about My Abilities First, and this campaign has been replicated and is being replicated in other regions of the world. And thank you very much for your attention.